Uh, Very good evening, everybody. This is DMA's FMGE Hacks, and today we are going to talk about the psychiatry. So, speaking about the psychiatry, the very high yield areas are going to be your mood disorders. The very high yield area is going to be your mood disorders, and then substance abuse, and then you have the miscellaneous conditions where you expect to see around where you expect to see around 65 percentage. So we divide the psychiatry into three areas. Like, one is your neurobiological basis of psychiatry, and another one is your psychiatric disorders, and number three is your treatment options. So diagnosis and treatment are the common falls under the third category. So how are we going to approach the psychiatric people? First one is neurobiological basis of psychiatry. For example, like, we can able to say, the keeping the neuroamines in the synapse will help in the mood disorders, or maybe like a lack of a monoamines in the synapse could result in the depressive symptoms. So these type of a neurotransmitters and these type of a receptor integration can able to alter the mood status. So understanding the brain regions and their functions and the neurotransmitters and their receptors will help in the will be covered in the neurobiological basis of your psychiatry. Apart from the genetic disorder, where heritability and genetic contribution to your psychiatric disorders, you have to think about it. Now, speaking about the psychiatric disorders, so speaking of a psychiatric disorders, we are having the very first one is your mood disorders. So speaking of a mood disorders, we are having a major depressive disorder, and then you have this bipolar disorders, and then for the anxiety disorders, you have the GAD, and you have the panic attack, you have the panic disorder, or the GAD, which is generalized anxiety disorder, and SAD, which is socialized anxiety disorders. All type of anxiety disorders will be there, and we will cover up the psychotic disorders, schizophrenia, delusional disorder, and the substance related disorders such as alcoholic use disorders and opioid use disorders will contribute for the psychiatric disorders. So in nutshell, what are the diseases that will contribute majority of your psychiatric questions will be like, number one is your schizophrenia schizophrenia followed by mood disorders followed by opioid use disorder or substance related disorder or related disorder, or it may be associated with this anxiety disorder, or it may be associated with anxiety disorder anxiety disorder. These are the possible disorders that you may see. These are the possible disorders that you may see and hear over here, people. So anxiety disorder, schizophrenia, mood disorder, and substance related disorders are the four type of classification of disorders which are considered to be the high yield one, where you should not miss a single word. And then you have the diagnosis and management. You follow the DSM-5. So DSM-5 criteria for psychiatric disorder, and then the psychological therapy, the cognitive behavioral therapy, psychoanalysis, and other therapies. And pharmacological therapies shows antidepressant, anxiolytic, antipsychotics, and antipsychotics and mood stabilizers. So this is all about your psychiatry, people. Psychiatry is a very simple topic, and you may expect to see a lot of questions here, and scoring a 3 out of a 5. The topics which will help you to score 3 out of the 5 has been mentioned in the previous slide. You can able to write those disorder, and mastering them will help you score a good score in psychiatry. And this is all about the psychiatry, people. Thank you for watching, and we'll get back to you with another subject.